There is a lot of talk in cyberspace right now about health, medical data, and who controls it, in what manner, and so on. We could understand it better by taking the private clinic's patient example, which is located in Romania and is moving to another clinic in Germany. The patient asked the Romanian clinic, which has electronic files on him, to provide with his personal data in a structured, machine-readable format to be able to transmit the data to the relevant health professionals in Germany. The Romanian clinic should provide them with the personal data in commonly used open format like XML, CSV format, and so on. When selecting a data format, the organization should consider how this format would impact or hinder the individual's right to reuse the data. For instance, providing an individual with PDF versions of their records may not be sufficient to ensure that personal data is easily reused. In the context, we hear a common desire within the EU member states population that sounds something like this. It's time healthcare caught up to the other industries, and all patients should have all their information in one place, rather than scattered like a breadcrumb trail through the various hospitals, clinics, research institutes, or any other medical facilities within the public and private sector. We visited over the course of our lives trapped in data silos beyond our control. There is a trend now for a couple of years for all patients to have instant access to their medical records and health data. Cases where patients rely on various apps and devices to monitor and manage much of their own care, even before EU's GDPR. Between government insistence and tech innovation, you might think the barriers to sharing our health data will be soon a thing of the past. But there is a reason health data access is currently such a hot topic. It's because the hospitals, doctors, the health plans that control our medical records don't consider releasing them to be much a priority. And that unwillingness to share has caused all sorts of issues for patients who need their data to coordinate their chronic care. Some people call this data blocking and an interoperability problem. I think it's much deeper than that. Solving the interoperability problem is actually quite simple. Make the data available to patients and it becomes instantly portable. With a patient in control of their personal health data and information, the often proprietary concerns that bottle up data sharing disappear. The patient who can rightfully request every bit of his or her health data can walk it out the front door and share it with whomever they want. Portability solves interoperability once we have the data in our hands. The organizations and tracking of it can be accomplished via tech and self-monitoring applications. Getting rightful access to our data is still the hard part. For too many hospitals, doctors, and health plans are out of compliance with GDPR. The regulations that require them to release the data in the form or format that patient requests. These entrenched patterns of non-compliance have many causes, but one is that access to personal health data isn't a pressing issue for the majority of healthy citizens. The average person rarely thinks about the importance of their medical history until they need it, of course. Though it's only the truly sick, those who need access to their medical records the most in order to better coordinate their care who bear the brunt of bureaucratic red blocks standing in the way. GDPR, on its 68th recital on the right of data portability, recommend to further strengthen the control of the patient's data, where the processing of personal data is carried out by automated means. The data subject should also be allowed to receive personal data concerning the patient which he or she provided to a controller in a structured, commonly used, machine-readable, and interoperable format. And of course to transmit it to another controller. Data controllers should be encouraged to develop interoperable formats and enable data portability. And finally, we must understand that based on Article 20 on the right to data portability, we have the legal tool most needed to transport our private and sensitive data directly from one controller to another, based on our needs and willingness inside or outside our county or country.